My name is Julie Lord, and I'm a licensed independent mental health practitioner at ESU3 here in Nebraska. I've been working as a licensed clinician in Nebraska since 2010, and I've had the privilege of working directly in schools since 2016. The goal of this segment is twofold. First, to briefly review the key points from the previous signs and symptoms of trauma video in this series. And second, to learn more about the elementary and secondary signs and symptoms of trauma, and to look at how to implement trauma-informed strategies into our day-to-day work. Let's begin by defining what we mean by trauma. Trauma refers to an event or series of events that is experienced as physically or emotionally harmful, often resulting in lasting adverse effects on a person's functioning and well-being. As educators, we are on the front lines of supporting student mental health. Every day, we work with students whose experiences, both positive and negative, shape their behavior, learning, and well-being. While many of us recognize that some students bring emotional burdens with them to school, you may find it surprising that 62% of adolescents in Nebraska report having experienced a potentially traumatic event in recent years. Understanding the different types of trauma. So now that we have defined trauma, let's take a closer look at the different types of trauma that students and even educators may experience. These include acute trauma, which results from a single event, such as a car accident or natural disaster; chronic trauma, which stems from repeated and prolonged experiences, such as ongoing abuse or domestic violence; complex trauma. This often occurs in caregiving relationships and involves sustained interpersonal harm during development; historical or intergenerational trauma. This type of trauma impacts entire communities, often rooted in events like colonization, forced relocation, or systemic racism; and secondary or vicarious trauma, which arises from exposure to others' traumatic experiences. A reality not just for mental health professionals, but also for educators and school staff. It's important for educators and school systems to share common language and understanding about the different types of trauma. Having that shared understanding helps schools better identify and support students whose trauma may be affecting their academic success or social interactions. National data tells us that 1 in 6 youth between the ages of 6 and 17 experience a mental health disorder each year. That's why this training includes not only new insights, but also practical classroom-ready strategies to help you recognize when a student may need additional support and to know what to do next. Trauma doesn't just affect how a student feels, it also affects how they learn and behave. When a child experiences trauma, their brain may activate a fight, flight, or freeze response, an automatic reaction to perceived danger. This stress response can interfere with the brain's prefrontal cortex, the area responsible for higher-level thinking, problem-solving, and emotional regulation. Imagine trying to learn math while a fire alarm is going off. That's what it can feel like for a student trying to learn while in a state of distress. Common trauma-related symptoms include intrusive symptoms, such as flashbacks or distressing memories; avoidance symptoms, like steering clear of reminders or situations; mood changes, like negative thoughts, depression, or emotional numbness. It's important to note that not all children who experience trauma go on to develop PTSD. In fact, 3 in 4 children do not. That's where educators and schools have an incredible opportunity to make a difference. Positive school experiences, strong relationships, and even something as simple as meeting a student's basic needs, like food and safety, can promote emotional resilience and protect against long-term effects. As educators, it's essential that we know how to recognize the signs of trauma in our students and to respond with both empathy and consistency. Now that we've reviewed the key takeaways from the first video, let's take a deeper look at the impact of trauma in our schools. As educators, we often hear about the importance of meeting the needs of every student who walks through our door. We serve as content experts, instructional leaders, and more as we juggle our many roles every day. We educators witness firsthand the struggles students face both inside and outside the classroom. And yet, sometimes what we see from a student is just the tip of the iceberg, the visible behaviors or challenges that they present. What lies beneath the surface, however, can be far more complex and impactful. Just like each of us, our students are shaped by what is unseen beneath the water, things like stress, fear, grief, and unmet needs, all of which can influence how they show up in the learning environment. In this segment, we'll explore what might be floating beneath the surface for students, the root causes of behaviors, disengagement, or emotional responses that can sometimes be misunderstood. We'll also consider how these factors might look different depending on the student's age or stage of development. As we discussed earlier, mental health and well-being are deeply personal, but they're also shaped by the environments where we spend our time, at home, at school, and in our communities. As a profession, education is becoming increasingly trauma-aware, making important shifts in our understanding and practices to better support students' well-being and academic success. As students grow older and enter middle and high school, the signs of trauma can become more nuanced and are at times masked by what we might interpret as typical teenage behavior. While adolescents may have more developed language skills, that doesn't mean they'll talk openly about how they're feeling, especially when those feelings are complicated or painful. Instead, trauma in middle and high school students often reveals itself through changes in behavior, mood, and performance. That's why it's important for us to understand the kind of signs we might see and what they could be communicating. So let's take a closer look at some of the more common ways trauma may present in secondary students. Persistent worry or fear. To begin, we often see persistent worry or fear. Students may feel anxious about their own safety or the safety of others, especially if trauma involved violence or a sudden loss. This fear can be constant, and it may affect their ability to focus on school. Changes in academic performance. Next, be mindful of changes in academic performance. Students dealing with trauma may find it harder to concentrate, stay organized, or remember things. These difficulties can result in slipping grades, even when the student is trying. Increased activity or restlessness. Some students may show increased activity levels, restlessness, agitation, or difficulty sitting still, especially when they're asked to remain seated or work quietly. Irritability or aggression. Others may go in the opposite direction, becoming more irritable or reactive, expressing anger through outbursts or conflict with peers or teachers. Social withdrawal or isolation. You may also notice social withdrawal. Trauma-affected teens may disengage from social groups, lose interest in activities they once enjoyed, or intentionally isolate themselves. School avoidance or absenteeism. In some cases, this withdrawal leads students to avoid school altogether, either due to anxiety, avoidance of triggers, or the overwhelming nature of the daily routines. Frequent somatic complaints. Trauma often shows up in the body too. Look for frequent physical complaints. Just like younger children, teens may report physical symptoms such as headaches, stomach aches, or chest pains without a clear medical cause. Repetitive focus on traumatic events. A student may often talk about a traumatic event, revisiting and/or fixating on a specific detail as they try to process the experience. Heightened sensitivity to stimuli. As with younger students, trauma can also cause heightened sensitivity to sensory input. A loud bell, a crowded hallway, sudden movements, or even certain smells can trigger a strong emotional response where a student might overreact or underreact to sensory input. Risk-taking or impulsive behavior. Among high schoolers in particular, we may see an increase in risk-taking behaviors, such as substance use, unsafe driving, or physical fights, as a way to cope or feel in control. Discomfort with emotional vulnerability. Adolescents may avoid or show discomfort when expressing their own feelings. In emotional conversations, the student may appear emotionally flat or shut down, deflect when asked how they're doing, or act defensively when offered support. Expressions of hopelessness or suicidal thoughts. Perhaps the most concerning is when a student expresses hopelessness or suicidal thoughts. This may show up in comments about death, dark themes in writing or art, or online activity that raises concern. These are never things to overlook. They need immediate attention and support. Triggers and anniversary reactions. Keep in mind that certain times of the year, dates, or even media or social media stories can resurface and bring with it trauma symptoms. Before we move on to support strategies, it's important to reinforce that recovery is absolutely possible. Some students will regain their emotional balance and a sense of safety within a few weeks or months. Others may need more sustained support from school professionals, caregivers, and mental health experts. What matters most is that we stay attentive, compassionate, and proactive in connecting students to the help they need. When we recognize the signs, understand the why behind behaviors, and create learning environments grounded in safety and trust, we give our students the best chance to heal, grow, and thrive. By being informed about how trauma may present, especially in our middle and high school students, we could be better equipped to support those who may be silently struggling. Trauma can manifest in many ways, and some of the most serious impacts may be invisible to others. That's why it's so important that we remain consistent and intentional in our approach. While every student's needs are different, here are some key strategies that we can use to support children and adolescents who've experienced trauma. Create safe spaces for open dialogue, provide trauma-informed counseling or referrals, teach self-regulation and coping strategies, help students reestablish a sense of agency and hope, and involve trusted adults and caregivers in the recovery process. Trauma is complex, and as we have just learned, it can present itself in many ways. Fortunately, SAMHSA, the Substance Use and Mental Health Services Administration, provides us with clear guidance for applying trauma-informed practices in school settings. Let's close by reviewing the 4 R's of trauma-informed care, which can help us anchor our work in shared language and purpose. While you may be aware of these principles, naming them explicitly helps strengthen alignment across classrooms, schools, and districts. Realization. Realization means understanding the widespread impact of trauma and how it may affect our students and colleagues. Realization starts with awareness. Awareness that what we may see on the surface is only part of the story. Like the iceberg model we discussed earlier, we must consider what's happening underneath: fear, grief, shame, or unmet needs. When we realize the scope of trauma, we prioritize both physical and emotional safety, and we build trust through clear communication and consistent boundaries. Recognition. Recognition is our ability to identify the signs of trauma in students. This requires us to stay informed and to notice the indicators we've discussed in this training, and to approach those observations with curiosity instead of judgment. Fostering a culture of peer support and staff collaboration also strengthens recognition, because when we work together, we're better able to notice patterns, compare perspectives, and to support students in a more coordinated way. Response. Response is about how we, as educators, can act in our classrooms or schools every day in a trauma-informed way. This means we collaborate with students by offering choices whenever possible, from how they demonstrate their learning to ways to cope with stress. We prioritize building respectful relationships where students' perspectives are valued. Our response focuses on empowerment by highlighting their strengths and abilities, fostering a sense of control over their learning journey. We actively give students voice and choice in their classroom activities and decisions, recognizing their resilience and other individual strengths. When trauma is present, we respond by creating safe spaces and providing referrals when necessary. Resisting re-traumatizing. The final R is about actively working to avoid practices and environments that could inadvertently trigger or worsen trauma responses. This asks us to be mindful of factors that may impact how a student responds in a learning environment. By having awareness of individual trauma stories, triggers, and students' needs, we uphold the principle of creating a truly healing and supportive school climate for all, especially students with visible or invisible trauma. As we wrap up this training, you might be wondering, what's next? Or how do I apply this in my classroom? Here are a few key takeaways. Trauma is present in our schools, across all age groups and communities. Understanding how trauma affects students' behavior, learning, and development helps us create more positive and supportive school experiences. Trauma looks different depending on age. Younger children may regress or act out. Older students may withdraw, take risks, or struggle academically. Remember, behavior is communication. Pay attention and seek support when needed. Respond with care and consistency. No matter your role in the building, you can use trauma-informed strategies to provide safety, structure, and support. Listen actively, validate students' emotions, and create a culture of empowerment. I'd like to leave you with a quote from Maya Angelou. Do the best that you can until you know better. And then when you know better, do better. This training is about knowing better. And now, as a school community, we can also do better together. Let's continue to support one another. Let's create spaces where students feel safe enough to show up, supported enough to take risks, and empowered enough to grow. Thank you for the work you do and for your commitment to helping every student who walks through your school doors.